Refugee and Immigrant Communities webinar training for community-based organizations serving immigrant communities. I'm Stephanie Becker from the Sargent Shriver National Center on Poverty Law, and I'll be leading this webinar today along with my colleague Stephanie Altman of the Shriver Center and our esteemed guest Sarah O'Connor, Senior Attorney at the Legal Council of Chicago, who's also an immigration attorney. This project is funded through Blue Cross and Blue Shield of Illinois Community Grant and is a partnership between the Asian Health Coalition, EverThrive Illinois, the Illinois Coalition for Immigrant and Refugee Rights, and the Sargent Shriver National Center on Poverty Law. The goal of the project is to build community capacity for Affordable Care Act education, outreach, and enrollment to limited English-speaking populations. So let's quickly go over the webinar agenda. As a reminder, this webinar is a follow-up to the in-person training we held in January for enrollment specialists and community-based organizations who are helping individuals enroll in options under the Affordable Care Act. So the first part of the webinar, about 40 minutes, will be spent answering the unanswered questions from January, plus any additional issues that have come up, either through direct questions from your agencies or on Help Hub. Where helpful, we'll try to provide case examples. The second part of the webinar, about 45 minutes, we'll spend answering any other questions you have now. If you have questions during the webinar, please type them into the chat box, and we will get to them after we present. We will not identify who asked the questions, so don't be shy. And if we don't get to your questions, don't worry. We'll keep a record of them, and we'll answer them and send them out later. Our guest, Sarah O'Connor, as I mentioned, is an immigration attorney, so if you have any burning immigration questions, you can feel free to ask her at that time. The webinar will be recorded, so feel free to pass it along to your colleagues after the fact, because we know some people couldn't make it today. And then after the webinar, please answer the brief survey to let us know what additional topics or issues you'd like for us to cover in future webinars. So let's get started first with your questions that you had asked specifically regarding enrolling immigrant families. So your first question was this: will the Get Covered Illinois screening tool add the immigration questions? As you know, right now, it does not include, the Get Covered screening tool does not include any question about immigration or non-citizen status. And therefore, some people who have incomes below the Medicaid level but are not eligible for Medicaid due to their immigration status are sent to apply for Medicaid by mistake. We've talked to the Marketplace team, and at this time, the Get Covered Illinois screening plan, the Get Covered Illinois tool does not plan to add an immigration question to the screening tool, just because it's too difficult to distinguish between eligible and ineligible non-citizen categories in an all-purpose screening tool. Because of this, the screening tool may not be as helpful for a non-citizen or immigrant who would be eligible for Medicaid except for their immigration status. In this case, you should apply directly to the Marketplace, understanding that currently the LPR glitch may cause them to get sent back to Medicaid, which we'll talk about in a little bit. But remember that children and pregnant women are eligible for Medicaid regardless of their status. Next question. You asked, how do I get a specific language translator at the Marketplace? When calling the state or federal hotline, ask for a translator that can provide services in that specific language. Each hotline uses a translation service providing support in many languages. Healthcare.gov has over 150 languages, and the AID call center has over 80 languages. The AID call center may need to call you back if a translator isn't immediately available. If you have problems with getting translation or the accuracy of translation or translated materials, please post these problems to Help Hub so we can communicate the problems with CMS, the Marketplace team, or the specific insurance company. For example, a navigator posted just last week that the Blue Cross Blue Shield Spanish line was transferring people back to the English-speaking line. So we're in the process of working with Blue Cross Blue Shield to remedy this. This is a question that's on everyone's mind who works with immigrant communities. Will legal permanent residents who have not been able to get insurance through the Marketplace receive a special enrollment period? We know there is still a major glitch in healthcare.gov which will not allow LPRs who have not met the 5-year bar and who are under 100% FPL to get found eligible for tax credits, and instead are getting an incorrect Medicaid referral. This is very frustrating, and we know it's unfair. At this point, CMS knows about the problems in healthcare.gov and is trying to fix them. However, they have not indicated yet that LPRs will be given a special enrollment period past March 31st or be exempt from an individual responsibility provision because of the delays in enrollment caused by the federal marketplace. Many national and local groups, including those of us involved in this project, are advocating for a special enrollment period for LPRs and/or automatic exemption from penalty. We will continue to keep you posted on HelpHub of all these advocacy efforts. But just remember, too, that many people will have low enough income to be below the tax filing threshold. And although that doesn't help you or help your client to get coverage, they will not be subject to a penalty. And here on the next chart, you can see the tax filing thresholds. So if your client is below $10,000 in annual income, they are not required by law to file a return. Though, of course, you have to file a return in order to be eligible for the tax credits. But if you're under this amount, you will automatically qualify for a hardship exemption in the marketplace and not have to pay the penalty. So to deal with the LPR glitch, while it still continues to be a hurdle, we've gathered together some practice tips from other sisters, from HHS, and advocates across the country, and pulled them together here. You may already know some of these, but we thought it was worth repeating. First, if the client or your client has already been denied Medicaid, there is a new button on the Marketplace application to indicate a Medicaid denial, and we include the web link there. We've heard that some navigators have experienced success using this. Secondly, if your client's income for 2014 is predicted to be close to 138% of the poverty level, you can reapply for the applicant with income slightly over the Medicaid threshold to avoid a transfer to AIB. Third, we've heard that using the healthcare.gov call center to enroll by phone seems to avoid some of the ID verification issues that LPRs have been having. Fourth, we've been told that you should now try to upload verification documents instead of mailing them to the address in Kentucky. And if you previously mailed documents, we recommend you go back and upload them. Also, we wanted to underscore that we are still, the Marketplace team is still trying to document the problems in healthcare.gov. So if you receive incorrect information from call center staff, or if you are getting glitches or error screens, please forward that information, such as the call center staff name, to the gov.marketplace@illinois.gov email address, and take screenshots of the problems you're having, and then send that with the application ID to the Marketplace team. These continue to be really helpful for healthcare.gov to identify the problems. So now I'm going to turn the presentation over to my colleague, Stephanie Altman.
Thanks, Stephanie. So we're going to go through some additional practice tips now for dealing with legal permanent residence and the Marketplace glitch, which we know is something that you've been experiencing and suffering through. At this point, too, I'm going to mention, just because we had a little technical difficulty when we started, I know that you can now hear us and see our screen, but if you have any problems at all with audio, just type into either the question box or the chat box, and Stephanie will be monitoring that so she can respond to you. So in terms of more practice tips in terms of dealing with the legal permanent resident Marketplace glitch, we've included here some more of the latest information we've received from CMS. This is hot off the presses yesterday on further strategies that you can try, especially if someone does not have the type of status or the type of document that the system appears to be looking for. So after an applicant checks that they are not a U.S. citizen or a national, the next thing they'll see is a drop-down box that asks for various immigration statuses, numbers, and documents. In general, you're going to want to input all available numbers that the person has and upload all available documents. And this is different from what we thought in the beginning, where you look for maybe the highest form of documentation that you have. Instead, it seems to work better if people put in every available number or document that they have. If, for instance, an applicant doesn't have one of the statuses that's listed, and the example that CMS gives is probably the most common, which is if the person does not have a permanent resident card or a green card marked I-551, but instead only has, for example, an alien card or an I-94 card, which has their date of entry on it. Try to select Other Document or Status, and then upload any document that you have available. So if you check Other and then it drops down another box and it gives you another chance to check Other, you can then type into a box. And when you type into the box, you can type in green card or whatever documentation the person has. The other advice that we received is that you should try to upload an I-94 card anyway if the client has it, because this can help prove their date of entry, and it can help prove to the federal hub that they are actually here less than 5 years and maybe avoid being sent to Medicaid. So more fun tips for trying to get through the LPR glitch. The next question that we received is one that we receive frequently, which is, what if my client has a green card or they've been a legal permanent resident for only 2 years, but they've been in the country longer than 2 years? The federal rule is pretty clear, but the state guidance is a little different. So there's not clear agreement on this issue between the federal and state policy and regulations. That being said, it is our assumption that the federal rule will control here. The federal rule is that the person actually has to have been in a qualified status, therefore been an LPR, a legal permanent resident, for the full 5 years. So anytime that they were in the United States without legal status generally doesn't count towards that 5 years. Illinois, in their guidance, I understand, is a little confusing. So I know when people read it, it uses the definition of, quote, when they entered the United States or how long they've been residing in the United States. And so it's possible that applicants may be eligible in Medicaid if they've been in the country under another legal status and then became a legal permanent resident, but they have not been there for the full 5 years. Like we said, we expect federal law to control, especially now that the federal data hub is the one that's verifying this status. But if they do apply through Medicaid, it's possible that you could see somebody that's found eligible and you're wondering why. So the very latest that we have in terms of help for you on immigration issues and also on identity verification is linked here. And we know that you've had problems with getting people through the system on the identity verification issues, which sometimes happen to somebody who also has immigration issues, and in fact happen, as we understand it, more for somebody who has immigration issues because their identity can be more difficult to verify, but it also could happen for somebody who doesn't have immigration issues and just has credit history issues. So we've linked here to the very newest FAQs that we have on identity verification and how to deal with inconsistencies if someone gets a message that they have an inconsistency, or how to get past identity verification itself, and how to enroll in the marketplace regardless of there being an inconsistency screen. We've also linked here to the newest FAQs that we have from the marketplace on the citizenship and immigration status questions. Looking at those resources, we're highlighting, I mean, there's a lot of information in there, so we don't want to go through every single detail, and they're both posted, as you can see, on Help Hub. But we've highlighted 2 key questions from these resources here in this slide because we think they're probably the most relevant to some of the problems that navigators have had recently, especially with regard to people who have been mailing documents into Experian, which is the company that does the identity verification in Kentucky, and have not yet heard anything. So one of the questions that's answered in the FAQ, and we get a lot, is what if I have sent my documents in, but I haven't received a notice informing me that my identity verification has been processed? CMS is now advising people to call the Marketplace call center and ask for an update. So if you mailed copies of your documentation to Kentucky and you've heard nothing, call the call center. They will ask you for some information, such as your name and date of birth, and they should be able to provide you with an update. If they cannot provide you with a status update, you should ask for, or the call center should automatically contact an advanced casework team, but you also can say, please contact me with an advanced casework team to look into the status of your case, and the marketplace should be in touch with you. The other issue that we want to highlight is, what if I continue to have issues verifying my identity? How can I possibly apply for coverage? CMS said if you've already followed all the instructions provided in the identity process and you continue to have issues verifying your identity, definitely call the call center, ask for an advanced casework team if you can't get help on the first try. You can ask the call center to apply by phone, so they can complete the online application for you and sometimes get past identity verification where you couldn't do it on your own in the computer system, or mail in a paper application. The preferred way, from what we've heard, is to do it by phone. So this practice tip is just related to naturalized citizens. So one of the issues that we know that people have had, and hopefully it's getting a little better, are with regard to naturalized citizens who've had some problems enrolling. In particular, if they do not have a certificate of citizenship or their naturalization certificate or a certificate number. If that happens, consumers who are citizens, including naturalized or derived citizens, should attest that they are citizens on the marketplace. So when it asks if you are a U.S. citizen, check yes. The marketplace will verify their citizenship with the Social Security Administration if you put in the Social Security number, which you should. And if it cannot verify your naturalization and citizenship, it will try verifying it with Department of Homeland Security. Naturalized or derived citizens who don't have their naturalization certificate or certificate of citizenship can also try to upload a copy of their United States passport or any other citizenship documentation they have if they're asked to provide more information to the marketplace. And just in general, it sounds like it's better to upload more rather than less, so you may want to go ahead and upload a passport in any case. So one of the questions that we received after the last session is, what do I do? I've now learned that a person in deferred status under the DREAM Act, or DACA, are not eligible for the marketplace. What should I do if I mistakenly enrolled them in the marketplace? So just to reiterate the rule, people who have a DACA status or people in deferred status under the DREAM Act are not eligible for the marketplace, and they're also not eligible for Medicaid unless they are a child under age 19 or a pregnant woman who's eligible regardless of citizenship status. So it's our best guess that the application will be denied in the marketplace after their immigration status is verified, and basically it'll show that they don't have a qualified immigration status to purchase in the marketplace. However, if the applicant can go into the account and delete or preemptively remove it says remove the application from the marketplace, they should go ahead and do this to avoid problems. So now I'm going to address another confusing question about sponsors and deeming of income. We've been asked a couple of different questions about sponsorship, and one about why applications ask for sponsors, whose income counts, and then also whether sponsors are required to reimburse for medical expenses that are provided to somebody they have sponsored. So the rule in Illinois is that only, first of all, the AIB application asks questions about sponsors, primarily so that they can assess eligibility for SNAP, TANF, and AABD cash. Illinois does not count a sponsor's income towards someone's Medicaid eligibility. So the AIB application, as you know, asks for a lot of questions about a lot of programs and doesn't necessarily use that information or that income to count against or count towards somebody's Medicaid eligibility. Even if the second issue is whether a sponsor would ever have to pay back or reimburse the costs that were provided to somebody that they sponsored under the Medicaid program. So even if a sponsor signs an enforceable affidavit, which, as I understand it, is an I-864EZ affidavit, which is more common to have been signed by sponsors in the last 10 years for somebody that they're sponsoring to be a legal permanent resident or as a legal permanent resident. They are not responsible. They will not have to pay back any of the costs of health care provided to the person they sponsored if that sponsor receives emergency care or is a pregnant woman or child. And because, and I don't know if this is for sure a rule in all cases, but the National Immigration Law Center has said because most, if not all, enforceable affidavits of support are only signed to sponsor someone who is a legal permanent resident, and our state, Illinois, offers pregnant women, children health care regardless of citizenship, LPR status, or the 5-year bar. Those are the only populations who would be being sponsored by somebody with an enforceable affidavit of support anyway. So they are the only populations that are really even affected here, and they are specifically excluded from any reimbursement. So all of that is to say, as far as we understand, even if somebody is sponsored by somebody who has signed an enforceable affidavit of support, there will never be any way that they have to pay back any of the costs for any medical care provided to the person they sponsored, who would be a pregnant woman, child, or for any emergency care. If you want to know everything there is to know about this, National Immigration Law Center has a long 2-page detailed brief on sponsored immigrant status, and we have linked it here for you. So we're moving away from our immigration questions right now that we've received, although we know that you may have more, and as Stephanie Becker said, we will have time at the end of the presentation for you to answer additional or ask additional questions, and we'll answer them, and we do have Sarah here to help us with that. But jumping to some of the Medicaid questions that you've asked, which we want to be able to answer, whether because we know you enroll people who have immigration issues, but you also enroll people who do not have immigration issues. And there are a lot of other questions that you present that deal with other sorts of problems on the program. So one of the questions that we get more than anything is, when does Medicaid begin after an application is approved? And when can eligibility be backdated? There's been a lot of misinformation about this, so we've gotten out as many facts as we can out on Help Hub, and we've answered this question several times on Help Hub, but it bears going through again today. So the Adult Affordable Care Act Medicaid expansion is just like any other Medicaid program. It is effective on the date of application is completed, but if someone has medical bills in the 3 months prior to the date they applied, they are also potentially eligible to get those medical bills covered. They have to be eligible in those months, and they have to have medical bills. For the new ACA adult group in any area of the state outside of Cook County, there can't be any backdating for them before January 1st, 2014, because they could not have been eligible before the program ever even started. So that's, kind of confusing for people. Once we get to April and people get backdating for the new ACA adult group, it'll go back to January. So they'll get their full 3 months back. But now it only goes back as far as it can, which is January 1. If the person lives in Cook County only and they enrolled in county care, they may be eligible for backdating before January 1, 2014, because county care existed before then. Now, the only exception to all of this backdating is the premium level parts of the All Kids program. These programs work more like insurance, and the child is not eligible until after the application is approved and a premium is paid. However, a child may be able to get Medicaid with a spend down, which is with like a deductible prior to the premium level coverage beginning. So I'm going to go through some examples of these because I think this is one of the most complicated questions that we get. So here's an example of an Affordable Care Act adult. If you are, let's say, 20 years old and you do not have a disability and you apply for Medicaid, so you're applying for the new ACA Adult Medicaid group on February 3rd, 2014. If it takes a long time for your Medicaid to get approved and you don't get a decision until April 16th, 2014, the medical card will automatically be backdated to the month that you applied. So he would get a card for February and then for March and April. So the first time that the person would get their eligibility letter, it would go back to the month that they applied and go all the way through for a year. So the medical card already would be backdated to the date he applied. If he presented medical bills for the month of January, let's say, he had been in the hospital in January before he applied, and he had income that made him eligible for the Medicaid expansion in January, then he would also receive backdated eligibility for the month of January, and his medical providers, like that hospital, if they know that he has Medicaid, so he's going to have to tell them, can now bill for services that were provided to him in January. If he went to the hospital in December, though, back in December of 2013, he can't get that bill paid because the Affordable Care Act adult program didn't even begin until January 2014. So even though normally someone could go back 3 months, there was no program before January, unless the person was in the county care program in Cook County. So all kids. The All Kids program is a little more complicated, and the reason it's more complicated than other Medicaid programs is because it's a combination of Medicaid and a premium level program. So it's kind of two different things. It's Medicaid and insurance program all wrapped up into one. There are uninsured requirements. So at the higher premium levels, children have to be generally uninsured for at least 12 months in order to get coverage unless they've lost coverage from an employer or some other circumstance. And premiums are required to be paid at these higher income levels by the family, just like insurance. There are also exceptions to this uninsured requirement if, as I just said, a child loses insurance in the 12 months prior to applying. If a child is eligible for All Kids, they are not eligible to purchase insurance in the marketplace. So with a tax credit. They could buy it at full price, but if they're eligible for All Kids, they're not eligible to purchase insurance in the marketplace instead and just choose a premium tax credit. So that's why we see a lot of families with split coverage. The children have All Kids for the coverage of the children, and the parents have an option to purchase in the marketplace because the All Kids program goes to a higher income limit than the parent program. Even if a child is not eligible for regular Medicaid and backdating, they may be eligible for spend down if they had a large medical bill prior to getting on to All Kids. So this is confusing, so we're going to do an example explaining that as well. First, we just want to show you that on Help Hub, we have a very helpful chart on All Kids, so you can see what the premium level coverage, Premium 1 and Premium 2, and so you know which income categories pay for premiums and which income categories are on regular All Kids. So here's a backdating example for All Kids Premium Level 2 to show you how complicated it is, and hopefully to show you how to enroll someone. So let's say you're a 14-year-old and you apply for your 14-year-old for All Kids on December 13th, 2013. Her family income is at 250% of the federal poverty level, and she has not been insured for the past 12 months, so that's not an issue. Her application is approved on February 3rd, 2014, and the very first premium the family pays for this coverage is March. So her All Kids insurance coverage goes forward, not backwards. Okay, it works more like insurance, not like Medicaid. And it would begin on March 1st, 2014. Let's say she went to the doctor in February 2014 for a checkup. Generally, that service cannot be billed to Medicaid because it's before she was eligible and before a premium was paid. However, if she had received a major medical expense or had a major medical expense in February or January, like a hospitalization, she might be eligible for Medicaid with a spend down. So in essence, she can get backdating but with what's called a spend down or a high deductible. That's because children are eligible for Medicaid as a category regardless of income. So even if her income's high, if she was completely uninsured before the time her All Kids started, she may be able to get some coverage for that large medical bill. For a doctor's bill, the spend down would be higher than the bill itself. Another question that we have gotten a lot is about Medicaid presumptive eligibility, especially because with the hundreds of thousands of people applying for Medicaid now, the Medicaid applications have been taking a long time. So Medicaid presumptive eligibility has been around for a long time, but it's probably more important than ever right now because it takes so long to get a regular Medicaid application through the system. Pregnant women can get coverage immediately so that they can start getting prenatal care before a full Medicaid application is even submitted or approved. We've linked here to the Healthcare and Family Services and Department of Human Services description of the MPE, or Medicaid Presumptive Eligibility Program. If somebody's pregnant, and we've gotten this question a few times on HelpHub, if somebody's pregnant, ask the provider if they are, the person should ask their own doctor, are they a Medicaid Presumptive Eligibility provider? Because if so, they can sign them up right there in the office for Medicaid. If they need to find a provider who is an MPE provider in their area, they can call the All Kids hotline here. And then we've also linked to the rules for providers to be MPE providers so that you can see who can be a Medicaid presumptive eligibility provider, generally federally qualified health centers and hospitals. If a Medicaid presumptive eligibility application runs out, so you have eligibility for up to 2 months, before Medicaid is actually approved, please send us an email or post it to HelpHub. We can send this to Department of Human Services and try to ask for expedited processing. We've also learned recently, too, that it's possible to do an expedited SNAP application that also includes Medicaid as well as food assistance, and that also might be able to speed up your application. The other thing you could do is apply through ABE by phone, and that also could possibly speed up an application in this sort of emergency situation. So speaking of SNAP, we've been asked what happened with the SNAP auto-enrollment. So this was the people who received letters in, I think, October, November, asking them, or perhaps prior to that, my memory is failing me, asking them to return the letter and they could be automatically enrolled in the Affordable Care Act Adult Medicaid program because the state already had enough information for them in order to process their application. So many people were enrolled, but some people have not yet heard from DHS, and they're worried about the status of their application and whether they should reapply. The advice from the state is that they should check on the status of their application through the regular ABE customer call center. The call center can, just to remind you, also assist individuals who want to change addresses, who need to cancel a ABE application. We've been asked that, add a baby, which is another thing we've been asked, or even learn about the status of their application. But a tip from the ABE call center is make sure that when you call, you ask to speak to a caseworker. Don't use the automated system check case status option because that won't get you where you need to go. Instead, follow the prompts to apply for Medicaid or to get general information for cash, SNAP, and health coverage, and then have your tracking number available if you have it. If you did the auto-enrollment for SNAP and you don't have a tracking number, they can look you up by your address, your name, your Social Security number, and birth date. The caseworker will be able to tell you whether an application was submitted, whether it's in process, denied, or approved. So you really want to get to a caseworker. Also, Healthcare and Family Services has instituted some new features for ABE, which we just posted on HelpHub today. So check those out as well. The other questions that we get on ABE and Medicaid, there was a good FAQ that HFS just published last week. So it was after we did the in-person webinar, in-person session, and before this webinar. So check it out if you haven't seen it. We posted it on HelpHub. It has a lot of answers to some of the questions that you've all been asking. For instance, I applied for health care coverage on the marketplace. They said they transferred it to Medicaid, my application. When will I hear something? I don't know what's going on. How long will it take to process my application? How do you know you got my application? There's all kinds of answers, questions and answers there, including the one that we just featured on how to get through to the ABE customer hotline. And the last thing I'm going to address before I turn it back over to Stephanie Becker is this question about, and we've been asked a lot, if I'm denied Medicaid, will I still be able to purchase coverage in the marketplace? And what happens if I get denied after March 31st? So Healthcare and Family Services includes this in the question and answer guidance that we just referenced. It's their understanding that if your application for Medicaid was filed during the enrollment period and it's denied after the open enrollment period ends, that you will still have a pending application that will be transferred to the marketplace and that you won't lose your space or spot in line. However, we do need to let you know that CMS has not, the federal government has not said this in writing yet, so we're still waiting for guidance to confirm that that will happen. And there are thousands, obviously, of Medicaid applications pending, hundreds of thousands probably all over the nation. So CMS knows this is an issue and hopefully will be addressing it. You do need to make sure, however, that the Medicaid application was not denied because someone just didn't turn in paperwork or applied for coverage and didn't go ahead and do everything that they were supposed to do under the DHS rules. Those would just be procedural reasons for being denied. They have to have been denied for a substantive reason, like their income was actually too high for Medicaid or all kids, or their immigration status didn't meet the Medicaid requirements. And so that's important to know. Now I'm going to turn it back over to Stephanie Becker, and she's going to talk about some questions regarding private insurance in the marketplace and SHOP that you've asked.
All right then, switching gears to the private insurance, the marketplace, and SHOP. So we've heard this question a lot. Can brokers charge a fee to consumers? And there's no law which specifically prohibits brokers from charging consumers when they assist with enrollment to the marketplace. However, most brokers are compensated via commission or another agreement with one or more insurance carrier. Brokers registered through Get Covered Illinois must provide assistance to anyone who requests it, even those who qualify for Medicaid or all kids. And it's likely that most people using a broker will not be charged a fee. But consumers should ask about fees and other costs before entering into any agreement or using the services of a broker. If you want to find a broker certified to sell in the Illinois marketplace, check Get Covered Illinois in the Get Help section, and we have it here on the screen. And you can search by zip code and find an ACA certified broker in the second broker link for the National Association of Health Underwriters. Also, if you want to look up the certification or license of a particular broker, we have a link there for the NAIC where you can look up a specific broker. So when should you refer a client to a broker? Anyone can use a broker, but typically brokers work with small businesses. You may want to refer a business owner to a broker to understand their options to provide insurance to their employees and for themselves. An individual who wants specific guidance or advice on which particular insurance plan to choose may also want to consult with a broker who is licensed to advise on those plans. And as you know, Navigator cannot provide that type of counseling. So the SHOP, how does a small business access the SHOP? As you know, the online SHOP marketplace has been delayed a year. So a small business must enroll in the SHOP through a marketplace registered broker who can access the small business tax credit for them if eligible and who can help them understand the best strategy for their business. For example, it may be best for the employer to not offer coverage so that employees can access premium tax credits through the individual marketplace instead. On the other hand, the employer may determine that their employees are not eligible for financial assistance to the marketplace and would like, and he or she would like to provide an employer contribution toward the employee insurance. In this case, it may be better to use the SHOP or another small group insurance product. In either case, you should refer the business to a broker through the getcoveredillinois.gov Get Help section, and they can help them out. This is also a question we get a lot about preventive services. So the question is, how do I know if there will be a copay for these preventative services or if the services will be provided with no cost sharing? So the list of preventative care services, the general list, which are provided with no cost sharing or copays, is on healthcare.gov at the link provided, and it's updated regularly. The patient, however, should also check with their provider and insurance company prior to accessing the care if they want to confirm that a particular service is covered at no cost as a preventative service. The patient should be aware that some follow-up services or tests performed at a preventative care visit may require a copayment. If the patient wants to contest a charge, they can appeal the claim with their insurance company or file a complaint with the Department of Insurance at the link provided. So this is a question we got at the training last month. What if my husband lives in another country and we file taxes separately? Am I eligible for premium tax credits? Before we jump into the answer to this question, first a little background on tax filing statuses. So there are 5 different tax filing statuses: single, married filing jointly, married filing separately, head of household, and qualifying widow or widower with a dependent child. This is important. The filing status is important since it affects the ability to access premium tax credits in the marketplace. The filing status a person uses is based on their marriage status on the last day of the calendar year for which taxes are being filed. If more than one status applies, the person can choose the one that gives them the lowest tax rate. So let's get back to the question. If someone's husband lives in another country and they file taxes separately, are they eligible for premium tax credit? The short answer is no, because if you report on the marketplace that you are married and file separately, you will not be determined eligible for tax credits. However, the longer answer is you may be able to qualify for a tax filing status of head of household. Persons who can file as head of household are able to receive tax credits. In some cases, married persons can file with this status when living apart without a legal separation. If the person qualifies for this status, they are considered unmarried. The person can file if the spouse was not in the home for the last 6 months of the year, a home was maintained during the year, and the filer is able to claim an exemption for a child even if the non-custodial parent actually takes the exemption. So it's confusing. They also must pay more than half the cost of a qualifying tax dependent. So if you have any concerns or questions about your tax filing status, we put in the link for the Center for Economic Progress, which is a local group that provides free tax help. And there's also free tax help through the IRS website. So you can call there or email them and figure out your tax status. Also, the latest Assister newsletter, which we posted on Help Hub, tells navigators that if they think if their client is eligible for head of household, they've had most success getting tax credits if they call the marketplace and do the application through the call center rather than online. So the next question we got is, what should my clients expect to pay every month? Well, as we know, this is very different. It really depends on the person's age, where they live, and their income, if they're a smoker. So as you can see on this chart, it varies for the 27-year-old in Chicago with an income of $25,000. The lowest bronze plan after a tax credit is $96. The second lowest silver plan after the tax credit is $145. Compared to a family of 4 in Chicago with an income of $50,000, before a tax credit it's $628, but after it's $282. So it's very individualized depending on your situation. So how are tax credits calculated? You know, the Kaiser Family Foundation has a great tax credit calculator that figures it out for you. But just so you know, just kind of the basics, it might be helpful as you are helping clients. So here's the basic equation that is used. The tax credit amount is the cost of the benchmark plan minus someone's expected premium contribution. So let's break those apart. The benchmark plan is the second lowest silver plan in that person's area. So let's say Cook County. So the benchmark plan in Cook County would be the second lowest silver plan for that particular person. And then the expected premium contribution is based on a sliding scale depending on someone's income. So here is the income scale that, that is used to determine the tax credit amount. So those who are below 133% of the federal poverty level, so let's say an LPR at 100% of the FPL, would be expected to pay 2% of their income, or no more than $306 a year on premiums. While if you go on the higher side, those who are between 300 and 400% of FPL would be expected to pay 9.5% of their household income on premiums, so up to $4,366 a year. This expected premium amount is subtracted from the benchmark plan, which if you remember is the second lowest cost silver plan in the area. And from that we get a person's tax credit, which he or she can use on any plan in the marketplace. So let's go through an example, and thanks to the Center on Budget and Policy Priorities for these great examples. Let's just take John. He's 24 years old. He has an income of $22,980, which is 200% of the FPL. His expected contribution, based on the chart we just saw, is 6.3%, or $1,448. There are 3 lowest cost silver plans in his area, but the second one is the benchmark plan, which is $5,000. So his premium tax credit would be $5,000 minus his expected premium contribution of $1,448, and that leaves us with $3,552 as the amount of his tax credit for the year, which he can use on any plan. Now let's say John is older. He's 64 years old now. His premium is more now because he's older. However, his expected contribution is the same because his income has not changed. He's still at 200% of the federal poverty level. So he's still expected to pay $1,448. However, you see here he's going to get a huge tax credit, over $13,000, in order to keep his expected contribution down. So let's look at how John's plan choice impacts how much he will actually pay for premiums. If John chooses the benchmark silver plan, he will pay exactly what we showed him paying a few slides back, a little over like $1,400. If John chooses the lowest cost silver plan, he will pay a little less. However, if he chooses the bronze plan, he will pay $0 because his tax credits cover the entire premium. But remember, if he does choose bronze, he isn't eligible for the cost sharing reductions. So he needs to think about that when he makes his selection. And then if John chooses the gold plan, he will pay $2,948, but he may have lower copays or a wider network that includes his doctors. So it's important to check out all of the aspects of the plan, not just premium levels. And we wanted to mention here actually a new tool that was launched this month specifically on Illinois marketplace plans. It's called healthplanratings.org, and it accumulates all of just really important plan selection factors, all of your out-of-pocket costs, potential costs in a bad year, the quality of plans, and the doctors and the proposed plans. It accumulates those all in one place. So it's a great tool for helping you choose which plans are best for you. And actually, we'll show later, there's a webinar on this in a couple weeks where the developers will be showing how to use it. It's a free tool. You can get on now and check it out. But it's a really great tool, and it's just for Illinois. So we've seen this a lot on Help Hub, and the reason is, this question is, how do I tell if the plan includes cost-sharing reductions? Healthcare.gov did not do a great job at the beginning to indicate a cost-sharing reduction plan. It seems to have gotten a little bit better. But how do you tell? So first of all, you have to have a silver plan in order to get the cost-sharing reductions. So you've got to make sure that you're looking at the silver plans. But for plans with a cost-sharing reduction, Plan Compare does not display the savings in the same way it shows a tax credit. Instead, plans with the CSR applied simply has a descriptor which shows reduced costs, as you can see here in the red oval at the bottom. For comparison, see the bronze plan in the yellow above, which does not have that text. So you should be looking for reduced cost. You can also narrow your results to only show plans with the cost-sharing reduction by scrolling down and clicking the arrow that says Change next to cost-sharing reduction plans. This will show only the plans which include the CSR, so all of the silver plans. Also, remember that the Affordable Care Act puts additional out-of-pocket limits for those below 250% of the FPL. So here's a chart that shows the maximum out-of-pocket limits for cost-sharing reductions. You can see that they are less than the standard silver maximum out-of-pocket cost of $6,350. So just a tip, if you see an out-of-pocket limit that's above $5,080, you are not looking at a cost-sharing reduction plan, and you need to go back and make sure that you check silver or some other glitch is going on. So we're almost ready for questions, but first we wanted to talk about some resources. On the Illinois Health Matters Languages page, we have accumulated many different language resources, and Asian Health Coalition has provided us some great resources recently, which they translated in many different languages such as Tagalog, Vietnamese, and Arabic. And you should check them out, and they are on issues such as tax credits and setting up your accounts and plan types in the marketplace, and they're really easy to find, we hope, on the languages page on Illinois Health Matters. And then lastly, we wanted to mention 3 upcoming webinars you may be interested in. Next week, March 5th, Blue Cross Blue Shield of Illinois is going to be walking you through, or anyone who wants to listen, through their marketplace plans and answering questions about it. So it's going to be a really information-packed webinar, and it also will be recorded, so we can send around a link if you have to miss it. And then we have 2 Starting Strong webinars coming up. One, we're going to be showing you the healthplanratings.org, which I talked about, and at the end of March, members from the Healthcare and Family Services will talk about the Medicaid benefit package and care coordination. So I know that's a hot topic, and you won't want to miss that too. So just put those on your calendars, and you can sign up at the links right there. We will be sending around this PowerPoint to everyone who registered, so you can have those in front of you. All right, so now's the time for more questions. Okay, we have a couple questions, and feel free to type your questions in the chat box, and we'll read out the questions as we get them, if we can answer them. And now is your time to ask whatever you would like. Okay. So hold on here. This one? Yeah. Okay. Do you want to read the question?
So Sarah's going to address the question that was asked about international students. So she'll read it and then give you some information about that.
Hi, so the first question is, can international students get health care coverage through the marketplace if they have been here for 5 years? I'd like to start by making sure everyone remembers that the 5-year bar applies to Medicaid, and it only applies to certain categories of immigrants. To oversimplify it, we're talking about permanent residents who can be in lawful permanent resident status and have a 5-year bar to being able to access Medicaid. For the marketplace, there is no 5-year bar. The analysis is whether the immigrant is lawfully present in the United States. And healthcare.gov, if you go to healthcare.gov and immigrants, they have a nice list of who is considered lawfully present. But to answer this question, it would depend on whether the international student was in student status, which is generally an F1 visa, as granted by the Department of Homeland Security. And students who have that status are here lawfully present and can purchase insurance on the marketplace without any 5-year bar.
Thank you, Sarah. And when we distribute, just so you know, for other staff in your agency, we're going to distribute this PowerPoint slide in the recording. We will also put that as a question answer on a slide. Now, please go ahead and type in your questions, and then we can address any other questions that we have on either Medicaid, cost sharing, the insurance market, or immigration issues, so that we can answer them and get them up to everybody. I do want to mention that we have just learned from the Asian Health Coalition that Bosnian will be the next language that the materials will be translated into, and we will be posting those materials. And as Stephanie Becker mentioned, we're getting those new materials up right away all the time and linking them to both Help Hub and having them on Illinois Health Matters. So go ahead, and we'll give you a few minutes to type in questions. We can try also, if you have a question and you don't feel comfortable typing it in, if you raise your hand on the raise your hand feature, we can try to unmute your line and have you ask it verbally as well. Okay, we're going to take 1 minute break and have people mute you, and then, okay, so we have a new question. And I'm going to read it out loud and then see if Sarah can answer this. The question is, I have more clients who claim relatives that are outside of the U.S. as dependents. For the medical card rules, they do not count these dependents in the family, but are considered ineligible. But the marketplace keeps giving results that the clients are Medicaid eligible. So I'm not sure. Okay, so yeah, it may be an issue with the distinction between a tax dependent versus a family dependent. Okay, it's the consensus of our team here, Sarah and Stephanie. I'm going to put the phone on speaker in case either of them would like to add.
Yeah, so the marketplace is going to count them as part of the household because they are included in the tax unit. So that is why, so in terms of household income and the person's MAGI, they're going to be included because they're part of the tax unit. But they're out of the country, then they aren't being considered for health coverage. So I'm not sure why they're getting results that are Medicaid eligible. I guess in that situation, we may have to look at some of the details of the income levels and see exactly what's going on, but that's probably the distinction that the marketplace is using.
And as always, if you post the individual question to Help Hub, as an individual case example, so I have this person at this income level with this relative, without obviously any identifying information, we can try to answer it more accurately. And if we need even more help, then we can ask you to provide the application ID and then get it to the marketplace team. So please go ahead and type in. We have more time for questions. So we just received another question. For people who currently receive full coverage under CareLink, which is a Cook County health and hospital system program, but are ineligible for Medicaid due to the 5-year bar, is there any way for these people to avoid paying the penalty if they still file taxes? So this is an issue of whether CareLink is considered minimum essential health coverage. And from everything we've seen, charity care programs, which is what CareLink is not considered minimum essential health coverage. So what that means is they are open to the penalty, or it's potentially possible for them to have been considered to not have coverage for the year of 2014 and be assessed a penalty. Now, if they're low enough income that they're eligible for CareLink, it is possible, there's other reasons that they won't have a penalty, assessed on them, like they could file a hardship waiver, or they are too low for the penalty from the filing threshold. They're below, the tax filing threshold. So, and Stephanie's going to add something.
Yeah, no, I would add that. So we don't know how strict at this point IRS is going to be on the penalty, especially for low-income folks. So I guess I would encourage, Stephanie's right, it doesn't sound like it counts as minimum essential coverage, but there's no reason why the person can't try to apply for a hardship exemption at this point.
Right, and also, in addition, if this person is on CareLink and you said they were ineligible for Medicaid due to the 5-year bar, they should be eligible. Yeah, Sarah's about to, she's saying this, I'm talking for her. They would be eligible to purchase in the marketplace. So I know CareLink is, they would have to pay for coverage in the marketplace, and CareLink is a charity care program that is still in existence at Cook County Hospital. I know Cook County Hospital is looking at this issue of whether they're going to continue to provide this kind of charity care assistance, given that some of the people could purchase in the marketplace, like this person, but it might be too expensive to purchase in the marketplace. So I think they'll, they're kind of in between deciding whether they should purchase in the marketplace and they can afford to and avoid the penalty and have minimum essential health coverage, or keep CareLink as long as they can and maybe be vulnerable to the penalty.
So this question is, I had an applicant whose results stated she was eligible for emergency Medicaid. Is that considered covered, or will she have to pay a penalty?
Emergency Medicaid is Medicaid, so that's minimum essential health coverage. But emergency Medicaid for non-citizens typically only lasts for a very, very short time. So really only just during the portion of the time that the person is in the emergency condition, like in the hospital. If they're an undocumented non-citizen and they're not eligible for any other reason, then so let's say they only have emergency Medicaid for a month of the year, but the reason they were eligible for only emergency Medicaid in the first place is they were undocumented, then they themselves would have another reason that they wouldn't have the penalty assessed to them, not just because they had Medicaid for a month, but because they're undocumented, and undocumented people are, cannot have the penalty assessed to them. But you may want to check and make sure. There are people that we've seen recently who have legal status, for instance, but prior to the ACA, they were getting emergency Medicaid only because that's all they could get. Now they could get marketplace eligibility. So it's possible they could apply in the marketplace. So their actual status, if they have a legal status that would, not just legal permanent resident status, but any of the statuses that Sarah's talked about or any of the other ones that would make them marketplace eligible, you might want to check into that because they probably need ongoing care as well. Those are great questions, and we're going to also, like I said, we're going to type up the answers to the questions and add them into the slides as we go forward. So we have some more time, so go ahead and type other questions if you have any. Okay, so I don't see any more questions. We've tried to address, oh, there's another one. I know it takes people a few minutes to type in. Oh, okay, this is about the applicant that was on emergency Medicaid that was just asked about. If I remember correctly, she is less than 5 years legal permanent resident, and I started an application on the marketplace, was referred to AVE. Yep. Yep, that's still a problem we have. So she definitely is in that group of people who, she only got emergency Medicaid. But that's a good point, actually. If people do have an emergency and they're caught between the marketplace and AVE right now, they still can be eligible for emergency Medicaid, as they always could. So I guess that's cold comfort. But so I'll give people a few more minutes to type in. I know it takes a couple minutes to type in questions. You can also see if anyone wants to try to raise your hand. I can try my best at unmuting your line. Any other questions? Okay, so I don't want to keep everybody on, so as long as we have no additional questions, since I'm the last person talking here, I will close out the webinar. Our information, contact information, is here on the last slide that you're viewing right now. Sarah, please note, I think most people on the webinar were at our in-person BRIC meeting, and okay, sorry, we did have one other question. Okay, this is an issue that is complicated. We're still trying to get clarity on this, even as early as today. So we're going to answer this in writing. But the question is, if a client is over age 65 but does not qualify for Medicare, and they are a legal permanent resident under the 5-year bar, can they purchase in the marketplace? The answer is yes. Okay, it is clear that they are eligible for the marketplace, even though people have been told to the contrary. So we've definitely had marketplace call center and people reporting that they've been told you're too old to be in the marketplace, which isn't true. Nobody's too old to be in the marketplace. It's an issue of whether you're otherwise eligible for Medicare or Medicaid. In this situation, the person is not otherwise eligible for Medicare, and they're not otherwise eligible for Medicaid, I'm assuming, as well, because they don't meet the immigration status. And so they will be eligible for the marketplace. However, they may have problems getting through the marketplace. So that's been the biggest issue. So even if they apply and they're 70 years old and they look like they have income that's eligible for Medicaid, or they look like they should be eligible for Medicare, they might be sent over to AVE, and they will have to, we will have to do the same thing where we're rerouting, but they are eligible. Another question.
I'll read this. I have a client that applied through the marketplace. When he applied, was eligible for coverage but not tax credits. He thought that was due to his job, that he could not get tax credits. But at work, they do not provide him coverage. He tried application for the second time, but still client did not get the tax credits. We had him complete the employer coverage tool and confirm that they do not provide a QHP for him at work. What can we do in this case? Yeah, so this is, well, it depends on their income. It sounds like if he or she is an LPR under 5 years and under the Medicaid level, they're being denied tax credits because they think he or she is eligible for Medicaid. In this situation, I would definitely appeal because if you've gone through the Get Covered Illinois screener and the Kaiser subsidy calculator, and you're sure that he's eligible, which it sounds like, eligible for tax credits, it sounds like a problem with the call center, with healthcare.gov eligibility screening. So I would appeal the decision. You might, if you haven't done it through the call center, we've heard that some people have gotten better luck getting the tax credits when they do call the call center rather than online. So that's my second suggestion. But I would first appeal it, just so you have that in the records. Also, one last thing I would recommend is if you want to send us the application ID number, we can send that to the Marketplace team and to CMS for a follow-up, because they are still trying to troubleshoot cases for us. Okay, this is one other question. The employer tool asked how much it would cost for employer only, but it's the spouse who's looking for coverage. Yeah, so the employer tool is not the most intuitive tool, and I guess I'd have to look at that. So the spouse was denied tax credits. So I think that might be a specific situation. If you could email me maybe the specifics on the income levels, because it doesn't sound like it's because of the employer coverage option, but maybe something else going on.
Or, I mean, we're speculating, so again, I agree with Stephanie, send us the details. Send us if there's any immigration issue in that case, or if it's a citizenship case. And then also, I'm wondering, because it's the spouse that's looking for coverage, if maybe the employer's coverage to the employee themselves is below 9.5% of the household income. So this is the spousal glitch. There's so many glitches, but this might be the spousal glitch where the spouse isn't eligible for income. I mean, for the tax credit.
So here's another question. This is great. What happens when the applicants can no longer take the employer's insurance because they missed a deadline, because they were waiting on the Marketplace to compare plans? When filling out the application and asked if they are, hold on a second. When filling out the application and they asked if they are offered coverage through an employer, would they answer yes or no since they missed the employment period at work? So this is a question we've gotten a lot on Help Hub, and unfortunately you have to answer yes, because you technically had an offer of coverage, and it's completely unfortunate. Again, we know a lot of people who are going to be in this situation. So basically you have to say yes, you did have an offer of coverage, and you have to wait until the next open enrollment period for the employer. That being said, there's something called transition relief for the individual mandate. So you wouldn't have to pay the penalty because you're waiting for the next open enrollment period for your employer, but you still cannot get tax credits through the Marketplace. You can pay full price, but you can't get the tax credit. Okay, couple of questions coming through. I have a client for whom we submitted an application. She picked an insurance plan and has started to pay her premium and now has an income change that is lower than the time of application. We made a change of income, and now she does not qualify for a tax credit, even with her income being lower than when she originally applied. Now that sounds wrong. I would call the call center if you haven't done that already, because that does not sound correct to me. And again, if you call the call center and don't get adequate information, can you send us the application ID number for follow-up? And file an appeal too. That's right. This is from tax dependence question. The client has an income of $17,600. A mother who is his dependent is in Mexico. The client is a citizen. Medical coverage was only for him. Was sent to medical card. I think this was incorrect, but no longer sure, as there are more similar cases and are still sent to adult Medicaid. I have to think about this. Mexico.
I mean, I don't know that we know enough information. I think for this question, you will have to post it to Health Hub or email it separately so we understand it a little better. So the client has an income slightly above the Medicaid levels if he was a sole, household of one. He has a dependent in Mexico, and the medical coverage was only for him, but he was sent the medical card. So maybe they counted them as a household of two. That's what. Okay. So Sarah's saying that she thinks that you are correct that the decision to give him Medicaid may have been incorrect, but typically people do not appeal it when they get Medicaid, even if it might not be correct. They would wait for the next redetermination and see. We'll look more into it just to ensure it, and we'll answer it in our answers just to make sure that they are not a household of two. But it doesn't sound like it because his tax dependent is somebody who is not his child or spouse.
Well, and it also depends on how much support he or she provides his mother. So there's an income amount that's necessary for a qualifying relative. So it's a little complicated, so if you send us some of the details, we can help figure that out.
Thank you. So if we don't have any
other questions?
We have a few more minutes, so if you have any others, type them in. Okay, so thank you very much. These are great questions, and like I said, for any of your colleagues who couldn't get on, and for the people who we sent the invitation to, we will send out this recording, a link of the recording, as well as PowerPoint slides, these PowerPoint slides, but we will also enhance them with any of the questions and answers that we answered here today. And thank you again for joining our webinar, and have a great day.
And one quick thing, actually, sorry, Stephanie, if you could answer, I think we have a 5-question brief survey that'll get sent to you right now when that webinar is over. If you wouldn't mind answering that for us, that'd be really helpful so we know about what to focus on for the next webinar.
And who else to send it to as well. So I know I'm stopping myself and then adding something to Stephanie because I have to be the last one speaking. But I just want to also say we are very interested in other colleagues that you have who may not be certified navigators, they don't have to be, who work with people on the front lines, enrollment specialists, case managers, other organizations, community-based organizations that you work with where they are coming into contact with people who could enroll. We would like to get them more informed about this information in general, not maybe to this level of detail. So if you can help us by providing even the names of organizations, please let us know. Thank you.
Thank you.